Welcome to A State of Sight. I'm Isaac Porter, and this is your update in ophthalmology and eye care from Raleigh. Today, I would like to explain the recovery after inner-layer corneal transplantation. This is called endothelial keratoplasty, and the two most common techniques that are used for this are DSEK, Decimase stripping endothelial keratoplasty, and DMEK, Decimase membrane endothelial keratoplasty. Now the recovery is a little bit different in between both of these, but there's a lot of similarities, so I thought we could cover both. One of the primary things after surgery that's very important is the positioning of the patient. So after the procedure, the patient lays flat on their back in recovery for 1 hour because we leave an air bubble inside the anterior chamber. Now that's the small area in between the cornea and the iris, right in front of the eye. And what this air bubble does, it helps push against the graft in order to help it stick in place. Over time, the graft holds itself and pumps itself into place so it sticks itself, but until it has a chance to do this, the air bubble helps hold it up there so it can start working and hold it there itself. Now when I do DSEK, I also put a suture through the graft down towards the bottom part of the cornea. So this suture also helps hold the graft in place, but the air bubble and then the graft itself are really what gets it to hold permanently. So for the first 24 hours, we ask the patients to lay flat or at least have their nose pointed straight up to the ceiling so that air bubble floats up so the eye is turned up, and then the air bubble comes right up against the back of the graft. We let them take a quick break for a restroom or a quick break to eat, but the more they can do that, the better chance the graft has to attach. Then when we look on the first day, we hope that it's 100% attached. And if it's not, potentially we may need to put in another air bubble, or we may need to have them position with the air bubble that's still in the eye if there's enough left. Now, the chance for needing to put more air in is greater with DMEK than it is with DSEK, but in the end, hopefully we'll get 100% attachment eventually. On the first day, the vision may be cloudy. We're not too concerned about that as long as the graft's attached. Now, also, afterwards, there may be sutures that need to be removed. Usually we can get these out during the first month or so. People also have to use different drops during the recovery, including steroid drops and antibiotic drops. The steroid drops may need to be continued for an extended period of time to keep down the chance for rejection. And then also, the best vision comes, it seems, with DSEK about 3 months afterwards when we can get new lenses in the glasses, or with DMEK probably sooner, maybe around 1 month. If you look back to A State of Sight number 11, there's more comparison between the two procedures, but this is a pretty good summary of the recovery and how it goes afterwards. But if you have any extra questions, please post them. We'll be happy to answer them, and hopefully see you again soon next time on A State of Sight.